Long story short, I almost died giving birth. So yeah, I ended up having an emergency C-section at 35 and a half weeks because throughout my entire pregnancy, I had gestational hypertension, which is basically high blood pressure, not at a dangerous level, but it needs to be managed. Because what can happen is gestational hypertension can turn into something called preeclampsia, which is when your blood pressure starts to, I'm not an expert, but I think it's when it starts to affect the placenta. So yeah, I think 25% of gestational hypertension cases eventually turn to preeclampsia, develop into preeclampsia. So, and then if that turns into eclampsia, you're fucked. So, yeah, it was really unexpected. We were taking my blood pressure and it was staying super high. I had taken the blood pressure medication that I'd been prescribed and it just wasn't going down. I had an awful headache that painkillers weren't touching. I was prescribed very strong painkillers for my pregnancy. And yeah, it just wasn't touching it at all. So it was like, okay, we contacted our doctor and he said that we should go to hospital to be tested for preeclampsia. So we were kind of like, does this mean that he's coming out? So we packed the baby bag, the hospital bag, just in case. And then, yeah, we showed up at the hospital. I had my blood test and the doctor was like, yeah, it's time for the baby to come out. So I was like, I am so not fucking ready for this at all. I mean, I don't think you ever are ready for something like that. And so, yeah, we went to a different hospital from there and I was admitted. They prepped me for my cesarean and they were giving me the anesthetic, and within about, what would you say, like 3 minutes or so,